Spinal stenosis commonly occurs in the cervical spine as well. We've talked about the lumbar spine. It's less common in the thoracic spine, but quite common in the cervical spine. Again, this is the front of the spine. Here is the back. You can see the anatomy is essentially the same with slightly different shapes. The lamina, the small facet joints that allow for movement, the discs in between, and nerves that come out at every level. When spinal stenosis occurs in the cervical spine, the symptoms are slightly different than they are when it occurs in the lumbar spine. The difference is that there's spinal cord in the cervical spine, and when you compress the spinal cord, the effect is different than if you're just compressing the nerves as you do in the lumbar spine. When you compress the cervical spinal cord, the symptoms are typically in the neck and arms, and it can be numbness and tingling, weakness, pain certainly. When it gets very advanced, then it can affect your ability to walk. Patients will complain of being unsteady or falling, and that's usually with advanced cases of spinal stenosis. The symptoms can be very mild for a very long period of time because the stenosis actually develops over a very long, many years, if not decades. And people can live with the symptoms as long as it doesn't get in their way of functioning or their activities of daily living or their quality of life. It's when it becomes really neurologically impactful and there's weakness and numbness that's constant that we start to think about surgical intervention. The surgery itself is similar to the surgery we perform in the lumbar spine. It involves a laminectomy. Again, here's the lamina, and you're removing some or all of the lamina depending on how many levels are involved. Sometimes the surgery is done from the front as well, through a small incision here. The idea is to recreate the space in the spinal canal, remove the offending disc, any thickened ligament, remove the lamina that may be causing compression. All of those things are removed, and the idea is to recreate the spinal canal.